Welcome to a series of recorded virtual forums entitled Healthcare Cleveland, COVID-19, 2020 and Beyond. Hosted by Case Western Reserve University School of Medicine, I'm Stan Gerson, Interim Dean for the school. We held these forums prior to the first presidential debate on September 29th. Broadcast from our health education campus, a new state-of-the-art teaching and learning facility that the university shares with the Cleveland Clinic. One of the topics for the debates is healthcare. And through these forums, we hope to showcase Cleveland's robust medical community, the nation's leader in research and delivery, biotechnology and innovation, medical and interprofessional education, and healthcare reform. Each forum includes panelists who are experts across our faculty, from our affiliated hospitals and national and community health partners. Through them, we will show how we rapidly pivoted and have been managing the COVID-19 epidemic here in Northeast Ohio, as well as other pressing issues affecting global healthcare today. We hope you enjoy these lively discussions, expert opinions with real-time examples, and audience participation. And we hope that they will help share your perspective on the political environment and decisions we have to make this fall. We hope you enjoyed this panel discussion and are leaving better informed about Greater Cleveland's medical community and how we are managing today's healthcare issues. And most importantly, how we are discovering medical breakthroughs, treating patients, and saving lives. Thank you for watching, and keep healthy and safe.
Good afternoon and welcome everyone to our session here this afternoon, Advancing a Culture of Health and Equity in Cuyahoga County. I'm honored and thrilled to be part of the Case Western Reserve University School of Medicine Forum Series, Healthcare Cleveland, COVID 2020 and Beyond, leading up to the first presidential debate next week here in our city. Cleveland is one of the nation's leaders in healthcare, with 4 world-class medical centers surrounding the School of Medicine, training tomorrow's physicians, providers, and scientists, while also focusing on how we can partner to better achieve health for every member of our community. This is our opportunity this afternoon to deliver our perspective to the nation. My name is Heidi Gullett, and I'm a family and public health physician here at Case Western Reserve University School of Medicine. And I've been honored to work alongside my colleagues on this panel for the last 7 years in our health improvement partnership, Cuyahoga Collaborative. I'm also thrilled that we're joined by Dr. Julie Gerberding, who has the distinction of being the first woman to hold the director position at the Centers for Disease Control and Prevention. And she's graciously given up her time in the past to meet with us as local health department colleagues when she's here visiting in Cleveland, and is also a proud alum of Case. So you'll hear more about her current roles, but as a fellow female physician who's looked up to you for many years, thank you for joining us as well. So I'll now invite each panelist to introduce themselves, beginning with Ms. Delores Collins, well known in our community as Miss D, followed by Greg Brown, Martha Halko, Dr. Gerberding, and Andrea Szabo. Ms. D?
Yes, thank you, Heidi. My name is Ms. D, or Delores Collins, as Dr. Heidi just said. I am the Executive Director of A Vision of Change. I'm also a certified community health worker, and I'm the founder of the Greater Cleveland Community Health Workers Association. Thank you.
Good afternoon, all. And I want to say that I'm really happy to be here. My name is Gregory Brown. I'm the Executive Director of PolicyBridge. PolicyBridge is a research and advocacy public policy think and action tank that focuses on issues affecting African American and other underserved communities. I've been with the organization in either a board role or a staff role since its inception in 2004. And just want to say that I am pleased to be part of this convening today and hope to share with you insights and perspectives about not just structural racism, but the idea of how you build a comprehensive community initiative that is multi-sectorial.
Good afternoon. My name is Martha Halko, and I am a co-director of prevention and wellness at the Cuyahoga County Board of Health. And I'm really grateful to be part of this webinar series with my colleagues. We go way back with HIP Cuyahoga. And I've had the privilege to be involved with HIP Cuyahoga since its inception in 2009. I've worked with a great team of colleagues, both here at the Board of Health and many of the folks on this panel, kind of shepherding backbone functions and establishing an equity foundation and providing strategic direction. So I look forward to our discussion today.
Good afternoon. I'm Julie Gerberding. I am a double alum of Case Western Reserve University. I'm currently on the adjunct faculty at the School of Medicine here, but also at the University of California, San Francisco. And I'm the Chief Patient Officer at Merck, which is a role that puts me front and center in issues of population health, and currently helping to lead the Merck response to COVID-19, which affects us across all of our markets around the world. But I've also had the wonderful experience of visiting Cleveland, the county, and the Ohio State Departments of Public Health. And in my tenure at CDC, it was really one of my favorite places because overall, really one of the best in the country. So it's a great honor for me to participate and express my appreciation for the hard work that's gone on to really try to deal with this pandemic effectively in the community. Thank you.
Good afternoon. Thank you for having me here. My name is Andrea Szabo. I'm a third-year medical student. I've had the great opportunity to be working with HIP Cuyahoga on my research project for about the past year, as well as I was able to work with the COVID-19 response at the Cuyahoga County Board of Health. So thank you again for having me.
Thank you all very much. And just before we jump into our discussion, just a moment of housekeeping. We look forward to answering questions from our audience today, and we would ask that you please use the chat function to submit your questions. At the bottom of your screen, just look to the left of the green share screen button and click on chat. The white rectangle will appear on the right of your screen, and you can type in your question and hit enter. We'll begin addressing audience questions somewhere between 1:40 and 1:45, but feel free to put them in at any point. And I already see some comments from the audience, so we really appreciate you joining us today. So let's jump right in. The Health Improvement Partnership Cuyahoga, or HIP Cuyahoga, as it's affectionately known, is now a large cross-sector community health improvement collaborative, but it traces its roots back to the Place Matters movement here in 2009. Greg, can you walk us through the past decade of this work and how the understanding of historical context has really guided us to the work that we see happening in our community here today?
Well, yeah, Heidi, thank you for this opportunity. I guess I would start by saying that my kind of participation in HIP Cuyahoga was kind of a inducement by the Place Matters issue, which was a national movement to look at how the idea of place influenced the health status of communities. And one of the things that helped me to understand the intersection between health and place was data and statistics that were being used to support the idea that everybody wasn't being treated the same way. There were health disparities, and those disparities really did run along racial lines, ethnic lines, and influence certain communities, especially urban communities and rural communities, much more than, say, suburban and exurban communities. So understanding that, moving from Place Matters, joining HIP Cuyahoga in 2010, and continuing to go through national trainings through the Place Matters movement and local trainings through HIP Cuyahoga, facilitated by Common Health Action, we were able to really start to understand and to develop a framework of thinking around how do we approach this idea of health disparities in conjunction with the idea of dealing with the systemic and structural issues that exist, not just at the community level, but at the regional level, the national level, and the international level. So it was not just about how do we develop programs or interventions, but how do we develop better systems and structures to support the work that we do. And that led us to really asking the Kirwan Institute at The Ohio State University to conduct some research around not only race, but real estate and the issue of public policy as it relates to that here in Cuyahoga County. And we called that History Matters. And that report really was a seminal report in really codifying how redlining and other public policies that started in the 1930s influenced the patterns that we see today around racial disparities in our communities. So building upon that, we started to think about how do we develop interventions. We also conducted community-based research and came up with a health improvement partnership plan that has been in 2015, that has been modified twice since then to once again look at not just what we do, but how we do it. We've identified some critical areas, initially 4 critical areas. Now we have 2 overarching areas, which are trust and structural racism, but we also have health areas that we're looking at too. And we have those areas to support the idea of how we look at structural racism and how we look at creating trust as a way of really framing and understanding so that people can move from where they are now to a much more equitable society. I think over the last 10 years, and I'll conclude because I don't want to hog all the time, but what I would say is over the last 10 years, what I think has been really exciting is to see how people have engaged and become aware of the structural and systemic barriers that have created the work that we have to undo and recreate anew or reimagine anew a system that is more equitable. But the other thing is to understand that this is really very difficult work. It's very tedious work. And for every 2 steps you take forward, you might take 3 steps backwards. But you can't be deterred because what we know is ultimately we're really trying to improve the quality of life for all people.
Thank you so much, Greg, for that great historical context. And you beautifully condensed over a decade of work into just a couple minutes. So thank you for helping us understand that. Martha, to you, given this historical context, can you describe the definition of equity that has now been used across our community with our healthcare partners, public health, social service providers, and others that helps frame the rest of the work that we're all doing together?
Yeah, thanks, Heidi. And Greg did a great job capturing that. I'll build on it a little bit and go deeper in some areas. So as Greg pointed out, HIP Cuyahoga is really built on a foundation of equity from the inception. Our partnership's core value is actually to build opportunities for everyone in Cuyahoga County to be healthy. And this core value for us stems from our longstanding commitment to work together as a partnership to achieve equity. And so for us, equity is providing everyone in our county with the fair opportunity to achieve their fullest health potential. And we selected this core value and this foundation of equity because we have learned from our community residents and our collaborative assessment data, as Greg referenced, that your health is shaped by the opportunities you have to be healthy. As Greg pointed out, there are significant differences that we're very aware of in opportunities in our community to be healthy, and that's based on race, place, and many other social determinants of health. The worst health outcomes are in our urban core, which really validate where populations of color are concentrated. So we committed collectively to identify priorities and take action on those root cause issues, those social, economic, and environmental factors that shape health and opportunities in our communities. So through our involvement with Place Matters, we connected with a wonderful organization, Common Health Action, as Greg referenced, led by Natalie S. Burke, who has really partnered with us for many, many, many years. For those of you who don't know, Common Health Action is a national public health organization from Washington, D.C. But really, with our work with Common Health Action and Place Matters, a key takeaway from our time was the importance of beginning an equity-focused effort with capacity building and grounding. And we have really fostered that and continued that as we have had new folks join the collaborative, or as we have engaged other partners in our collaborative. So before we develop solutions together, everyone really working together should have a base knowledge and a common understanding and a common language around equity. And for us, this offers the opportunity to build a shared value and a shared focus on equity. And many of us have learned that this is both a personal and a professional journey. We all enter that space at a different level, and we understand that and we embrace that. We have leaders, we have supporters, and we have followers. That's kind of how we have, outlined that continuum. And so as we moved through the early part of our health improvement planning process, we engaged Common Health Action in our local efforts to help build that foundational understanding among our partners. And they really helped us with this idea of perspective transformation to change people's perspectives around equity. So as you know differently, you understand differently around equity, you act differently. And we really embrace that notion in how we shape the strategies and how we pursued our work collectively. And from that, we really achieved a shared value, a shared commitment for addressing or achieving equity and addressing structural racism. So Common Health Action facilitated capacity building with our partnership. And with that, it helped us develop a new narrative around public health. Public health traditionally has been focused on, historically, access to care, personal responsibility, behavior change. And with our work with Common Health Action and amongst our collaborative, it really helped us to shape a new narrative for public health, an upstream narrative of public health that focuses on, again, those social, economic, and environmental factors that shape health and opportunity. And for us locally, it's been with a very direct and intentional focus on structural racism.
Thank you so much, Martha. Really appreciate that perspective. Ms. D, I'd love to turn to you next. You have spent years as a HIP Cuyahoga Steering Committee member, but I'm really interested in you sharing with all of us what drew you to this work. You have decades of experience as a community leader and really have your finger on the pulse of what is needed at the community level in neighborhoods. And I'm curious what drew you to this work and what has sustained you for so long.
Absolutely, Heidi. Yes, a vision of change. We have provided, academic empowerment, intervention, and prevention services since '93 throughout Ohio. And our mission is to work with a network of organizations to cultivate relationships with residents, to educate and engage and improve social disparities. Our vision is to embrace, empower, and motivate communities within the greater Cleveland area. And Heidi, I've heard a lot of people say things over the years, right, about what they want to do in our communities. I've seen programs come and go. They fly in and fly out. And some of those programs were good for our communities. I was drawn to this work and continue to be involved because of what really drives the group. And that is the fact that you all were willing to address the elephant in the room. You looked directly in its face and saw it for what it was. You were willing to say and talk about the wrong that was done to us as a people of color. You were willing to look through a different lens, knowing that others would disagree with you. To me, that took courage, strength, truth, real commitment, care, and honesty. It's your mission, Heidi, that and your vision. And your vision is to make Cuyahoga County a place where all residents live, work, and learn, and play a safe, healthy, and a sustainable and a prosperous community. Your mission, which is to inspire, influence, and advance policy, environmental and lifestyle changes that foster health and wellness for everyone who lives, works, learns, and play in Cuyahoga. It's your key values, your key approaches, and your core values that continue to draw me to this work. It's you being driven to bring about change for all of us. And the words of Justice Ruth Ginsburg she says, fight for the things you do in a way in which people will join you. And I believe that is what HIP Cuyahoga is. So this is why I'm involved with this work. Thank you.
Thank you so much, Ms. D, and thank you for sharing your heart, as you always do. You are the lifeblood of this movement, and we thank you for that.
Absolutely.
For sure. And your untiring work in the community, which we'll get to in a few minutes.
Yes, okay. Thank you.
Dr. Gerberding, I'd like to turn to you next. And given your many years of working in public health and also working in the private sector, but at the interface of community engagement, can you share with us a little bit about how you see the role of collaboration across sectors, really tackling these wicked problems we've been talking about, the things like poverty and racism that make it hard for people to have opportunities to reach their full health potential and their full potential in life?
So I was just thinking back, I did my first clinical rotation in Cleveland at Rainbow Babies and Children's Hospital, and my very first patient there was a little boy who had very severe lead poisoning from the paint in his home. So when you said that health is about place and what it takes to deal with problems like that, it really does take a wise crowd. These are wicked problems, and no institution or medical school or NGO or public health entity alone can solve them. We got to get the communities to come together and really commit to the critical few things to focus on collaboratively, because it can't boil the ocean. Eventually we can get to a broader agenda, but we have to really decide where we want to start. And that does take broad-based coalitions and sufficient investment to prime the pump. But also, in my opinion, having now spent some time in the private sector, we really do have to get the private sector involved. Employers have a really important role to play with their own employees, but they also are often leaders in the community and are positioned in places where they can help catalyze the policy changes and the community engagement to get the ball rolling. So when you're lucky enough to have everybody coming at this from different directions, but all focused on a common broad agenda, you can really get something done. To me, that's been one of the amazing things about Cuyahoga County as a public health force of change. And I'm not surprised to see that effort continuing. But I know the road is long and hard, and the resources aren't optimized at any point in time, and particularly in the context of a pandemic like we are experiencing. There's no silver lining to COVID, but the one thing that it's forced all of us to confront is that there is systemic racism, that the social determinants of health do matter, and that the health disparities are really only one dimension of the broad economic disparities in our society. And we're not going to solve the health challenge if we don't work together on the broader issues. So pleased to see the effort and the progress, but also sobered by the challenge.
Thank you so much for that perspective. Sometimes I think we as a group and our broader group of colleagues, some of who are watching today, wonder if we're on the right path, because we don't see how things are in other parts of the country necessarily around these issues until very recently, and we really appreciate your perspective given your national leadership. In 2015, this is a great segue to the next part of what we were hoping to discuss, is that HIP Cuyahoga first declared eliminating structural racism publicly to be a key priority focus of the engaged organizations and individuals, a focus that we had to tackle to improve community health in Greater Cleveland. Greg, what have the efforts looked like thus far to eliminate structural racism in our community? And where do you see this work going in the short term and also in the longer term?
Well, Heidi, I think if we go back and think about this historically, one could say that we've made a lot of progress, at least in being able to name what we're trying to confront. because when we first started out, the idea that we would address structural racism was seen as almost something that people didn't want to hear. They didn't want us to use the word equity. They didn't want us to talk about the issue of disparities and inequities as it related to race, because they were afraid of the blowback from people. But I think that because we spent time learning what these meanings are in practical application, studying, understanding the data, creating documents, holding convenings, meeting with experts, we were able to develop a language and a philosophy that tied us together as a group in the Hip Cuyahoga movement. And we were able to begin to articulate some issues that were very difficult for people to run away from. I think when you say that at one time you could look at a 25-year disparity in life expectancy between somebody living in the city of Cleveland and somebody living in a suburb in Cuyahoga County, that would certainly cause people to at least open their eyes and to say, well, why is that happening? And what we've tried to do is answer that question. Why is it happening? Why does it matter? And what can we do about it? I think the other things we've done is we've tried to understand how to create this idea around perspective transformation that Martha mentioned earlier, which is not just thinking and acting differently, but it's also understanding differently, so that we internally have to change the way we view the world so that we can change the world externally. And working through that idea of perspective transformation, and then bringing in groups like the Racial Equity Institute to conduct training, or Common Health Action, or having other convenings where we bring people in from Robert Wood Johnson to talk about the relationship between health equity and public health. We were able to develop, I think, some credibility in the community around the issue. And as others have joined us, we have now culminated in this idea that racism is a public health crisis. I do not believe that 10 years ago or 11 years ago when we started that we could have ever imagined that here we are 10 years later and people have actually proclaimed that racism itself is a public health crisis. But what it means in the future is we must not only talk about what that means, but figure out how to change minds, hearts, systems, and structures, and reimagine a community where everybody has an equal opportunity and an equitable opportunity to live up to their fullest potential.
Thank you so much, Greg. Really appreciate your perspective and your leadership on the focus of eliminating structural racism over all these years. Back in 2015, Misty, and turning to you, one of the big priorities, in addition to the global focus on eliminating structural racism for our community health improvement plan, was actually in bringing our local health departments and our hospital systems together to do community health assessments together so that they could do what Dr. Gerberding mentioned earlier, which was work together to tackle these big, wicked problems. So I'm hopeful that you can share with us a little bit about your critical role and the most recent community health assessment that was a follow-up to that earlier goal.
This project, it really allowed us to have a voice at the table and really be involved. So our critical role was to, we organized a group of community health workers. Some of them were students from Cleveland State University School of Nursing Community Health Workers Program, and a few were also already certified community health workers. And they have to do like 130 hours, right? So we've recruited some of them, recruited certified CHWs, and we deployed working closely with Greg and the team, we deployed a training and an information session about the assessment. This gave us the opportunity to really network with other residents and some of our other community organizations to create the platform for us to come in and be able to provide the survey to some of the residents. This could have been at a high-rise, a senior high-rise building. It could have been local, like maybe street clubs, just different locations. We identified locations on the east side and the west side in the community to hold a community convening. And I think this convening was so super important because most of the time when we are a part of surveys and things, we never really hear about what happened with the results. So this right here, this convening gave us the opportunity to invite some of those residents back out so they could actually hear and see those results. And then to also invite them in to become a part of our network. Being a part of HIP Cuyahoga, we had the opportunity to create a group which is called Creating Greater Destinies. So this opened the door for us to invite even more community residents to be involved at that level. We also provided transportation. We wanted to do different things. We wanted to make sure we had door prizes. So we put raffles together. We reached out and so many people, you know, donated different items to us. So we were able to create the swag bags and things like that. We served dinner. That was wonderful. The thing was, like you said, is really being able to work together collaboratively to make sure that the community was really, really involved. So this was a very rewarding and exciting project for us. And we're looking forward to doing many more just like this. But the thing is, just that whole part of really, the great thing, let me just say this, the great thing, Heidi, Greg, team, it was the information. You all made sure that those handouts that we had, the infographics that were created, was right on point. We got so much good feedback from that information because they were really able to understand the full outcome of this project. So thank you very much for allowing us to be a part of a project at this magnitude.
Well, Ms. D, you are a partner, full-on partner in all of this. This wouldn't have happened without you, and we're so grateful for your leadership. Andrea,
Absolutely.
I'd like to turn to you. You worked really closely with Ms. D and her team at A Vision of Change to help collect information in order to inform what priorities our hospital systems and our health departments and other partners would work on together for the next 3 years. Tell us a little bit about why you chose to focus on that as a part of your medical education and what you learned from that process.
Absolutely. So one of the driving reasons for why I wanted to go to medical school is because I wanted to make an impact on my community's well-being. And I learned very quickly during the first week of school that at medical school that the importance of social determinants of health on an individual's well-being. I learned how the color of your skin, how the culture you identify with, your income, where you live, and many more descriptors all affect your health. It affects what type of medical conditions you are more susceptible to, if we're going to be able to screen for those medical conditions and catch things early enough, if treatment's going to be effective, or if treatment is even a resource for you. It seemed pretty clear in order for me to make the biggest impact on my community that I would need to be more involved in the social determinants of health. The community health needs assessment was a great way for me to get involved with this because we were able to identify those needs and come up with a improvement plan for our community. It was very important to me that we were not biasing the data collection that we were doing and that we were really truly getting all the information that we needed from those who were most in need. Because our analysis and our improvement plan would only be as accurate and as helpful as the data that we collected. So it was an honor to work with Ms. D and her team of community health workers to reach out to the population rather than just mailing surveys, anonymous surveys to people's homes, but actually going out into the community and talking with folks, hearing their stories and really understanding what's truly affecting them and their lives. I think this allowed a great opportunity for us to build trust in our community and build these ongoing relationships that Ms. D continues to refer to. I think I've learned so much about the importance of collaboration, especially with stakeholders in the community. And I think this collaboration is what's going to be able to make the biggest change.
Thank you so much, Andrea. So building on that, again, we were trying to bring the hospital systems, healthcare systems, and particularly public health together over the last 6 years and really tackle these upstream issues like structural racism in our community. And the Center for Health Affairs, our regional hospital association, has been pivotal in this process, bringing competitors together in a crowded healthcare marketplace in Cleveland and helping us all work together around that shared agenda that you heard Greg and Martha talk about at the beginning, that focus on equity together. So I'm curious, Martha, from your perspective as a local health department leader, tell us how this long history of working together positioned us to really pivot into a COVID-19 response without missing a beat, just moving right into what the community needed in a time of crisis.
Yeah, absolutely. And actually, I would say it's the history of working together as well as our historical knowledge of how our history has shaped our current health. So that understanding of how many historical discriminatory policies and practices have limited opportunities for people of color to achieve their full health potential, that understanding made us keenly in tune to the health disparities associated with COVID-19. And through our work with HIP Cuyahoga, you know, we use this phrase, we apply an equity lens to our public health efforts. And for this response, we ask if any population is being disproportionately impacted, and we applied that lens here. And as we considered our response plan, we asked ourselves, how do we assure that we are understanding and meeting the needs of everyone, especially those who are disproportionately impacted? You know, through this response, we learned early in the pandemic that COVID-19 does disproportionately impact people of color. Our data clearly showed that. For example, while Black people only represent 30.5% of the population, they represent around 40% of the COVID-19 cases. There were higher rates of hospitalizations, higher rates of ICU admissions, and higher rates of deaths. So, you know, we took that information and it was critical to our response. And as we formulated that plan, I would say our collaborations were critical. I'm going to point right back at you, Dr. Heidi Gullett. You were instrumental to our response. Andrea was critical to that response as well, with a whole team of preventive medicine residents. A huge, probably 80% of our staff at our agency is engaged in the COVID response and continues to be. There's countless hours of planning, great collaboration with Metro Hospital. Ms. D, from the community health worker perspective, she shared that her community health workers herself and others were getting certified and trained in COVID response and still outreaching to the community and engaging with us and communicating with us. Internally as an agency, we established an equity group, in essence, to dive deeply in how we would support the community in our efforts. And this work is really being guided by my wonderful colleague, Nichelle Shaw, and a colleague of all of you. My name's on there, but only my name's on there. Nichelle is doing 99% of that, and I appreciate it so much. But we focus on developing and implementing an equity-based strategy as part of this response to ensure that we are meeting the needs of those who are being disproportionately impacted. And we went back to our public health roots too. We looked at our data, we looked at our maps, we went back to the community partnerships that we've already established to identify places that we could do community testing, and built it, and built on those trusting relationships to ensure that we were meeting our community's needs, to ensure our messaging was reaching the people that most need to be heard and to hear our message. So that's just touching on it, but it was really, really critical, and it continues to be critical as we move forward. Those learnings were absolutely essential to how we move forward and for us to maintain a foundation of equity as we continue down the path of this pandemic.
Thank you so much, Martha. That's a really helpful perspective. One thing I keep hearing throughout our discussion today, and I know our work all along, has been the power of relationships. And I keep hearing all of you really underscore that, and certainly reflected in your comments there, Martha. Dr. Gerberding, earlier in the panel, you referenced the importance of public-private partnerships. And I'm curious if you could help us better understand the role of public-private partnerships in addressing health inequities, such as what we see in COVID-19. I know you've had a long history of addressing emerging health issues and pandemics and SARS early on in your tenure as CDC director. So I'm really curious about your perspective there, given your current role for the last 10 years.
Well, I can summarize that very quickly by saying, again, the scope and scale and long-term nature of the problems that we're trying to solve have to be done with collaborative sectors coming together. And I think the private sector has a really important role to play in that. But if you just kind of step back and look at probably the most important social determinants of health or poor health in Cleveland, for example, in Cuyahoga County, there's the whole issue of the built environment, both from the standpoint of toxins like lead, but also the access to sidewalks and exercise facilities and so on and so forth. There's the issue of food deserts and the ability to get clean and healthy, safe and healthy food, just physical safety, not just the gun control issue, but just broadly speaking, the physical safety of people, which also varies by zip code. And that's really the point that I wanted to make. The last 2 digits of your zip code are more important to your health than any other of your vital statistics in Cleveland and in most other communities around the country. So, beyond that, there's the opportunity for enrichment, for educational opportunities, for broadening, retraining. And one of the ways that I am championing this, and certainly my CEO at Merck, Ken Frazier, who's one of only 4 African-American CEOs in the Fortune 500, is to really, as an employer, place our emphasis on economic inclusion. We can't solve the lead paint problem, but we can create jobs, better jobs in places where people have trouble reaching jobs. We can support talented students to be able to reach for better education opportunities and better positioning in schools. And particularly these days with the demographic divide in our aging workforce, where America's labor force is actually shrinking as our population ages, we need to invest in retraining our so-called blue-collar workers to upskill and be able to contribute to higher level jobs. That's something employers can do now. That's certainly something that the university is interested in supporting. And I think these are ways in which these private-public sector activities don't just have to be a social program. They can be strengthening things that we already have a stake in and an interest in doing, but in ways that are sort of leveraging the unique perspective, experience, resources, and intellectual and monetary capital of the various players in play. I don't claim that there's any great victory, but I do feel like the conversation has changed a great deal. And again, COVID has forced most people in our country to wake up and smell the roses about what's really going on with the growing disparities in our society. And people of color are the emblem of that disparity in almost every community.
Thank you so much for that thoughtful and comprehensive answer. It's really helpful as we're challenged to think about the next phase of our work here on the local and regional levels. Greg, it sounds like, and we all sort of see that our country is really at a reckoning with the things that Dr. Gerberding was talking about, really understanding how do we address racial injustice via systemic change? How do we change the systems and structures that are creating the downstream outcomes that we talk about with, whether it be COVID-19 or whether it be other health outcomes? And I'm really curious, as you're really been a leader here for many decades, how do you feel or hope that our community will embrace this work around addressing structural racism going forward? It seems that we're at a pivotal time at that intersection of COVID-19 and racial injustice. And at this level within Cuyahoga County, how do you see this work going forward, and how do you hope our community responds?
Wow, that's a that's an outstanding question, Heidi. I want to do a quick reflection, and then I'll try to address the question specifically. You know, I was born in 1952, and 2 years later, Brown versus the Board of Education was passed in the Supreme Court of the United States of America, that basically said that you couldn't have separate but equal education systems, which led to this whole idea that this whole concept of separate but equal, which had been in force for almost 80 years, going back to the Plessy versus Ferguson ruling, actually started to at least create the idea that we had to have systems that merged and systems that looked at the idea of everybody having the same opportunity structures and the same kinds of ability to at least engage and let their own personal ability flourish or not. So like I said, I was born in 1952, so I went through that whole civil rights movement, and then had the Vietnam crisis come, and those things shaped who I am and who I became as a person and as a professional. And when I think about the idea of structural racism or racism as a public health crisis, it's all put in the context of this idea that this country was predicated on the Constitution that said a number of its citizens who were slaves were only 3/5 of a human being. And that culture and that attitude has permeated our system throughout the history of this country. Unfortunately, those feelings are still prevalent today in many ways. So the first thing we have to do is come to a reckoning about, in my estimation, come to a reckoning about, are we all citizens of the United States, regardless of our creed, our color, our nationality, our ethnicity, our gender, our sexual orientation? And that's the first step. So that's going through that perspective transformation piece, starting to think and understand differently so we can act differently. And we need to really encourage people to search their souls and not have a epiphany of the soul, but epiphany of the mind and the soul, so that we can move forward. And then the thing we have to do is to evaluate every system and every structure for its efficacy based on an equity lens, looking at it and saying, is this really equitable for everybody? And if not, why not? And what do we need to do to change that? I think those conversations are starting to occur. I think people are more and more starting to understand that we cannot be a house divided and continue to be competitive in a world environment. But I still say that based on national conversations and election year and some of the machinations of our politicians, and some people who want to go back to the way it was when there was separate but equal kinds of accommodations. You can't allow that to stand, because that interferes with the thorough and complete progress of a nation. And if we want to move forward, we have to address not just the economic systems, but the social, cultural, educational, and health systems as well. And the intersection of those will create the kind of synergy necessary to move us forward, because we will start to think similarly, not alike, but similarly about who we are as a nation and what it means to be an American citizen, and who has those rights and who does not.
Thank you so much, Greg, for your powerful, powerful comments. You, I can speak personally, you have transformed my understanding of race and racial equity, and I am forever grateful for that as an individual, but you've just shared all that with our audience, and we're very grateful for that, Greg.
Thank you.
We have a list of questions that were emailed in and have been added in and are just absolutely wonderful, remarkable questions, and we only have 9 minutes left. So I'm going to jump in, ask the first question actually to Greg in picking up with what you just said. And the question is, so many of these issues we're discussing are impacted by policy, and you are our resident policy expert on the panel, especially policy at the national and federal level. Understanding that there is no single policy fix, what do you think is the single most important national policy, legislative or regulatory, for which we should advocate? And I'd like to go to Dr. Gerberding after Greg on that.
Well, can I reframe the question for a minute? Because I think I want to take issue with the question itself. I think one of the things we talk about at PolicyBridge a lot is that public policy may seem like it's a top-down process, but it really is a bottom-up process. And it starts with communities coming together and starting to frame policy perspectives and then moving those things up in terms of a systems change theory. So if you think about it, most systems change starts at the bottom where the technological or the innovation starts, and then it moves up. So I believe that we have to create change at the national level or at the regional level, state level. We've got to start at the local level and use local innovation and creativity as models that we can take upstream to demonstrate that this stuff has some efficacy. If we don't do that, then we're talking about large systems changing, large dollars to be expended, with no real understanding of the implications of whether it is efficacious or not, and whether it's going to be beneficial or not. So my sense is we start small, we pilot, we learn, we grow. And as we do policy, we frame policy that way. We start policy with what we can do locally. We influence policymakers and key leaders locally, and then we move upstream. And we've done some of that in terms of our work around economic inclusion. We've done some of that around the idea of policy and advocacy, understanding how to get grassroots citizens to go to their local communities and to the state legislature and advocate for change in education and healthcare. But that would be my way of thinking about it. I'm not so sure that we would be using our resources and our time best by trying to work at the national level down. I think we should spend our time working to build coalitions and collaboratives locally, and then building those, making them strong and moving up.
Thank you so much, Greg. Dr. Gerberding.
I agree with what Greg just said, and I will also make a case for top down, but I grew up in a very tiny town in Midwestern South Dakota, where we had all kinds of weather catastrophes and tornadoes and floods, and we never once called FEMA. So we were very used to solving our problems at the local level, and I do agree that is the most powerful place where things really do change the fastest. But I think we're dealing with broader issues in our country, and we have a federal government right now that's not being held accountable for the breadth of problems that we're facing. And I'm not getting into any kind of political conversation here. That's for next week during the debate. But I do believe that, you know, we're having this conversation because we are passionate citizens. Voting has never been more important than it probably is this year. And really trying to force the conversation to go beyond the parochial local concerns to consider the broader state and federal and international perspectives, because what's at stake here is our future as a democracy. And I don't think that there is enough momentum yet across our broad base of communities to really mobilize the kind of change if we don't also engage our federal officials and particularly our Congress. So not everybody can engage at that level, and I think we need all the layers to come into some kind of an alignment. But because I have had government experience and I chair something called the CSIS Commission on Global Health Security, I'm putting my personal energy at the federal level because I think we've got to chip away and re-inform and re-educate people. We've had some tragic losses of activists and advocates in our Congress this year. We certainly have had a tragic loss at our Supreme Court, and I think we have to we have to work effectively at that level as well. So I'm totally with you, Greg. And you know, I'm a frontline old feminist marching in the streets of Cleveland, as a matter of fact. But I think we also have to address the broader federal and international concerns as well.
Thank you so much for that very insightful perspective. We have so many wonderful questions. We could go on for another hour or two, but we're not allowed to do that. So I'm going to pose the very last question, which was actually the very first question we received a few days ago via email. And I think it takes it back, Greg, to what you were just talking about. And the question is, I would like to know what rubrics are in place to allow you to measure whether or not you've actually achieved equity in the healthcare system in Cuyahoga County. And it could be the healthcare system, but it actually could be our system in general. And Misty, I'd love to go to you first and see how you respond to that. What do you think would help us see that we are moving toward equity in our community?
I think for us to be more inclusive, and what I mean by that is by allowing us to be like a part of the entire process, right? Not just inviting us to be on an advisory board, but to actually allow us to have a voice, right? It's realizing that the ripple starts from the inside, right? So I'm thinking it's just like things that should happen in our community should happen from the inside out, not the outside in. I guess I want to say it's using the power of recognizing and believing in our potential, our talents and our gifts as assets. And I'm hoping that I'm answering this effectively to what the question, was.
Absolutely, Misty. You always have such an insightful perspective on the ground work.
And it's also really utilizing the power of listening, right? Our conversations that we have in our communities can really make a difference and add value to the work that wants to happen or take place, right, within our community. And it's having that empathy. It's not feeling sorry for us, right, but remembering and realizing that we are human and we do want to be treated with respect. So I hope that kind of
Thank you so much, Misty.
Question.
You really highlight how interdependent we all are on one another and that we are all in this together. We really need to understand each other's perspective. Thank you so much for that.
Absolutely. Thank you.
Greg, I would love to just give this last question to you. If you have really pushed us as a collaborative to really define how we're going to know if we've achieved equity. And while I'd love every panelist to give that response, we're almost out of time. But Greg, if you could take us home here on your thoughts on that question.
I come from a background where you measure what's important. And one of the things I'd like to see is us to develop the same kind of metrics around inclusion, diversity, and equity that we have for all other kinds of things that we do in our society. But developing metrics is only one part of it. Then collecting the data to juxtaposition against the metrics. And last but not least, but then holding people accountable if they set goals or objectives around those metrics and not reaching them, how do we hold them accountable? So I think what I'd like to see is for us to really start to put some things in place and start to measure those things in terms of diversity, inclusion, and equity, collecting the data, measuring change over time, and holding people accountable for not being able to make the changes. And when I say accountable, I don't mean penalized, but I mean actively discussing, working with, and training people so they could change the perspective, understand it differently, and therefore leading to different actions coming out of that.
Thank you so much, Greg. Wow, I just really from the bottom of my heart want to thank every single one of you for joining us on this panel today. I've learned a whole lot, and I know your time is precious and your expertise is invaluable. So thank you so very much for helping us share the work we're doing here in Cuyahoga County and bringing really important national, international perspectives, Dr. Gerberding. So we're very grateful for all of your efforts over the last few years, and we look forward really to sharing with the audience in the future what our next chapter looks like in our shared work. So thank you to the Case Western Reserve University School of Medicine, as well as the interim dean, Dr. Gerson, and especially the team behind the scenes who's been organizing all of this, Susan Reichert and Marcia Palmer. You have been champions behind the scene, and we thank you so much. And finally, thank you to all of you who joined us today. We wish you all safety and health in the days ahead. Take care.
We hope you enjoyed this panel discussion and are leaving better informed about Greater Cleveland's medical community and how we are managing today's healthcare issues. And most importantly, how we are discovering medical breakthroughs, treating patients, and saving lives. Thank you for watching, and keep healthy and safe.